everyone. Like I said before, everyone jumped in that I'm suffering a little bit from an allergy attack today. So I'm a little bit sniffly and a little bit stuffy. So please be patient with me. And yeah, we'll move through this for sure. My name is Tiffany Grant. I'm happy to be here to talk to you today. This is something that I'm truly passionate about. And um, teledentistry in Missouri has actually been really, really great. And we were one of the first people, like groups in the country that were states in the country that was actually implementing and doing teledentistry successful. So I'm excited to talk about some of those things today for sure. A little bit about myself, which you heard a little bit. I live in O'Fallon, Missouri, um, in the greater St. Louis area, and I work in private practice right now, and I have a family of 7, and they probably are why I have the sniffles probably right now. And I'll go ahead and skip that. So I want to talk a little bit about teledentistry advocacy. Teledentistry, it seems kind of like a new thing. It was kind of like a buzzword that happened during COVID because we realized more than normal that people could not access their patients and they could not access people because of COVID. And so teledentistry was a mechanism to give providers access to their patients due to COVID. So I'm going to talk a little bit about advocacy on a national level and on a local level that occurred. And sorry, it's for some reason it's not formatting right there, but hopefully you guys can follow along with me. So teledentistry seems like a new buzzword, but it started in 1974. It was a project with the Army where it was a subgroup of telemedicine, which is often how it's categorized. In 1989, Westinghouse Electronic Systems Group, they developed a teledentistry project, which was part of a dental informatics project through Westinghouse Electronics Group. In 2010, how it really just came right back on the scene. Dr. Paul Glassman out of California, out of Pacific University, he developed or conceived the first virtual dental home there. He advocated for the legislation to allow reimbursement for teledentistry service. And this, sorry about that, guys. This model, um, this model is a model that has been replicated all over the country. So, and so I work with Dr. Suter, which he is like a teledentistry guru all over the nation, and he happens to be here in Missouri, and I work for him in his private practice. And he actually went to one of Paul Glassman's presentations, and he knew this is something that Missouri needed. We were working in Jefferson County, which is considered a really rural area of Missouri. And he was starting there as a newly graduated dental student, going to be a dental director at a small community health center in Jefferson County. So that presentation at Paul Glassman pretty much changed his life. And he was very, very passionate about bringing teledentistry to Missouri at that time. In 2003, Dr. Suter becomes the first dental director of Comtree, and he creates a couple locations throughout that county for dental services. But that particular health center was really spread out in different locations. It wasn't just one building. And so there was a lot of disconnection happening from getting one person to, medical service, or getting one person to mental health services, or getting, typically a person in need, they have a lot of different needs, but it was really disjointed and it was really hard to get people to where they needed to be, especially across a rural area. So in 2014, Dr. Suter presented the concept of teledentistry to the Missouri Dental Board, and they were receptive and wanted to support it. And he got other stakeholders involved throughout the state. And he made a recommendation because in the legislative, how the Practice Act for telehealth went, it had dentists as providers, but not dental hygienists. So even though teledentistry from dentist to dentist work, but it's not ideal when you're trying to provide access. Dentist to dentist type of teledentistry is it happens in consultations, but it's not really the type that you need to break barriers to access. Because the thing is, we don't have a lot of dental providers available, so that's not ideal. So we wanted to get hygienists added to that bill as teledentistry providers in order to make it better. So that's what he did. He advocated for that. He got all the dental oral health stakeholders in the state to advocate for that. And we got it amended in the telehealth practice bill to add dental hygienists as providers. Soon after that, he actually, while he was working on that simultaneously, he created a grant for oral health primary care integration pilot within a medical clinic at Comtree. So that's kind of how I came into it. I was hired to be a part of that pilot where I was a dental hygienist inside of a medical practice. During that time, there were no oral benefits in the Medicaid. So what we had was a lot of people who were presenting either to medical practices or emergency room for dental treatment because they didn't have any benefits. And so not only did medical providers not really feel comfortable looking in people's mouth to see what was the problem, but a lot of what they could do was either palliative or not enough to really do any type of comprehensive care or get them guided to the place that they needed to go. So I went into the medical practices and I started taking x-rays and I started looking in there and I started being able to bridge that gap from the medical clinic to dental clinic because I was able to schedule appointment directly in the medical clinic for a dental appointment. A lot of times I can get a doctor to kind of stop and take a look at x-rays that I was taking simultaneously, which is kind of like teledentistry. But we start to actually build like the way that we were going to do teledentistry through this pilot. Now, we didn't bill it out, but we started to practice different workflows of how it could possibly be done and how it could work. After the revision of telehealth, adding hygienists as a provider of teledentistry happened in 2016, we actually got another grant to go in Herculaneum, Missouri. And they have one elementary school, one middle school, one high school, and one Head Start program. And they also had a nursing home there. And we start to pilot teledentistry in those 5 locations in that rural area, just to see what kind of access and outcomes that we had. And we gleaned a lot of information from that outreach. Lastly, we made a revision to the dental rules regarding like how we can retrieve the information, how dental hygienists can retrieve the information needed for a teledentistry examination. And by developing those models within those 3 years and learning kind of what to do and what not to do, we end up training 12 dentists, 6 hygienists, 4 dental students. We saw over 1,230 patients. We saw people in different care settings, as you can see, schools, nursing homes, detention center, primary care offices. And then Dr. Suter left that health center and we went, he bought a private practice and we even started to do teledentistry there, which his practice Greenleaf is also in House Springs, Missouri, is in a very rural area as well. So we started to practice teledentistry. we created Access Teledentistry as a consulting group where we talk to people all over the world regarding how to implement teledentistry, how to do teledentistry. We mainly work with large health centers most times, but we work with a lot of advocacy groups as well to help pass teledentistry in different states, help look at board rules and state laws to make it available. And we've been very busy, especially COVID. And I'll tell you a little bit about what we've been doing since COVID to help with access. Um, and right now we work with we work through a HRSA grant with the Missouri Department of Health and Senior Services to provide teledentistry education throughout the state with different health centers, different groups to teach teledentistry. So we've been busy with that as well. So the thing about teledentistry, there's a growing body of literature and a need for innovation, which I think when you think about rural health, there's a lack of innovation. I mean, I think to think of ways to increase access to care. And I think we just have to think outside of the box a lot of times to help find those solutions. So this is what we do know about dentistry and how people receive their dentistry. We know that there's a decrease in total dental visits, even though there's an increase in populations and there's an increase in dentists. There's a decrease in typical regular dental office visits. When you think of the dental office as a brick and mortar four-wall office, sorry about that. There's a decrease in visits. There's a decrease in office visits there. There is an increase, as you see, 73.9 of people who visit federal qualified health centers to receive their treatment. And you also see there's an increase in hospital emergency department visits. So what you can see is that people are not receiving their care from normal places. They're going to different places. They're not going to the regular brick and mortar offices. And I think that's what we see in medical care, period, that people are not going to the traditional places to receive dentistry. And this is something that dentistry as a profession really has to look at how people are receiving treatment, where they're going to receive treatment. So if you give me 1 second, I'm actually going to. Okay. So when you think about cost versus delivery model, um, you can see how there's different delivery models of dentistry and the cost of doing those different models of dentistry. People who don't have access to dentistry, you're kind of looking at hospital dentistry where it's probably the least comprehensive type of dentistry where they're just doing palliative treatment and there's no definitive care. There's no definitive follow-up. They're just probably getting medication. There, and it's the most expensive type of dentistry visit that you can imagine, someone going to the emergency room to receive dental care. And then there's doing nothing, which the cost is very high with that too, because you've probably seen cases where people died from the lack of dental treatment, where abscesses are killing people. So this is a different models, but you see where teledentistry kind of falls there. So a lot of people wonder why clinic versus teledentistry. What makes teledentistry more affordable is that you don't have the fixed costs associated with teledentistry. A lot of times when you think about the brick and mortar office, you think about the electricity bill and you think about the water bill, the actual maintenance of the building. But with teledentistry, since you're doing like I was talking about the different care settings that I went to, like the elementary school or the middle school or the high school or the nursing home, those facilities are taking care of the fixed cost and you're going to the patient. So that makes the visits a little less cheaper. Also, what we found out that the visits are typically shorter. You're able to do more, and you're actually able to do more preventative treatment during a teledentistry visit. We work with ATSU out of Kirksville and St. Louis, and they helped us do the study when we were doing the teledentistry pilot in Herculaneum. They actually studied all our patients. They looked at what procedures we did. They looked at the fixed cost, and this is what they came up with. It's that teledentistry was a cheaper visit due to fixed costs mainly. And teledentistry visits also took longer, more of the dentist time and the hygienist time, but overall visits were shorter. So when you think of teledentistry, there's a lot of different applications, and me and Dr. Suter really honed this down. And I just want to say that this is our thoughts on this is nothing like I don't want to say it's not research based, but these are just from our experiences. So I just want everyone to keep that in mind when I discuss this. It's not like textbook or anything. This is just how we've categorized applications of teledentistry when we teach people about teledentistry. So these are just different ways you can use it. There's a limited evaluations and triage, which we saw a lot of during COVID when people could not access their patients and they were in pain. So we did a lot of limited evaluations and triage. You can do it for examination, hygiene only coverage, satellite office coverage, which is the common thing that we see in rural health is satellite office coverage, where if there is a dentist in St. Louis and they want to have a satellite office in like an hour away, teledentistry may be a way to do that. And maybe the dentist, why the hygienist does all the exams and prophies. Well, they don't actually do it, but they facilitate some of those teledentistry examinations. Then the dentist can maybe come twice a month to do the treatment on those patients. So that's a way that we see teledentistry applied in rural areas throughout the country. Specialist consultations, which is great too when you think about rural health, because a lot of times those patients don't have access to specialists. So when the dentists have the ability to send the information directly to the specialist, and that the patient doesn't have to drive an hour just to see, an endodontist or oral surgeon to tell them, hey, we can't treat that and that needs to be extracted anyway. That's definitely helpful for sure. Or if there was an image that maybe had some pathology, like it needed further examination, like the doctor saw a patch in the mouth, wasn't really sure what it was, they can send imagery to an oral surgeon for oral surgeon to take a look at that image. So those are different ways that we use it. Outreach application too. There's a lot of school outreach programs in Missouri that go to different schools, and teledentistry would be a way, especially if they did not have a doctor that could go, but you can send a hygienist to access the schools. This is a way to expand access to rural children that live in rural areas. Medical and dental integration. That's another way. If you have a small medical clinic there, if you can put a hygienist there to take information, that's another just innovative way to get people access to dental treatment. And then lastly, there's the patient monitoring devices. So,
Tiffany?
Yes.
Can I ask a question?
Yeah, sure.
And along that, because it popped into my brain now. So I just can't wait for Q&A. So, so when you all do that, can you use like the mobile vans that the federally qualified health centers, because they have mobile units. So would that be an option? Okay.
Yes. So I'll go into that a little bit more to kind of explain how those applications may play out. And it's really going to get your mind kind of ticking like, wow, that's the way. Because when you look at people by like, I think what teledentistry does best is when you have limited resources, you're using your resources to the highest scope that you can. And when you think of a doctor, when you think of a dentist, you want to use them as their highest scope, which is diagnosing and restoring teeth. If you're pulling a dentist out of the office to take x-rays or sit in a school all day doing exams, that's probably not the best use of their time. And when you have a hygienist or maybe a school nurse or someone else who has the scope to do it and is willing to do it, and you're using them at their highest scope when you are doing that. And plus, you have way more hygienists than you do dentists, and just using people at their highest scope is super important. So these are kind of people's expectations coming out of COVID, patient expectations when they resume to normal activities. And so they kind of let you know where people's minds is regarding COVID and just going back to normal life. What we saw here is during COVID, you can see how teledentistry trended, how high it trended, because that was the only people can really, I think they really got a taste of, like kind of what, people with lack of access to things experience every day, when they couldn't, you just walk into a dental office or walk into a medical office when they had a major need or if they were in pain and trying to navigate that. So we had people calling us from everywhere. We were really shocked. So what is teledentistry? Which is, you would think I would put that in the beginning, but I think it kind of fits. So what is teledentistry? So this is me in a nursing home right there, and I'm seeing a nursing home patient. And if you can think about it, people in nursing homes don't have good access to a lot of things, and dental oral health is definitely one. So kind of meeting them where they are was super important. But it's means for a patient to receive services when a patient is one physical location and the dentist or the other oral health or general health practitioners overseeing the delivery of care for these services in another. So here, I'm seeing a patient in a nursing home while the dentist is inside the dentist's office. I'm collecting all the information that the dentist needs to make a diagnosis or a treatment plan. That includes x-rays, that includes period numbers, that includes photographs, whatever I feel like the dentist may need to make an examination, to do an examination and be able to diagnose and treatment plan. So that's basically what teledentistry is. It has the same standard care of an in-person visit. This is the Missouri Telehealth statute here from the state of Missouri. You want to deliver healthcare service by means of information or communication technologies which facilitate the assessment, diagnosis, consultation, treatment, education, care management, or self-management of a patient's health while such patient is at an originating site and the healthcare provider is at a distant site. And so we'll go in a little bit to break down some of this these definitions in this definition. These words in this definition. So patient of record, why this is important, because different practitioners have different levels of supervision, and this was one of the things that were kind of holding up teledentistry in Missouri, is that typically the doctor would have to see them first in order for a hygienist to be able to do anything on them. So we had to change that a little bit to make it where the dentist can authorize the gathering of certain information needed to make an examination before they were seen physically by the doctor. So that was a very, very important rule that we had to change in order to make teledentistry work in Missouri, and something that we kind of help states kind of develop. Important terms, you saw the word originating site. So that was the location of the patient, which I think during COVID was pretty funny because we set up, especially for limited evaluations and triage, we have to put the patients, if they zoomed in to talk to the dentist, and the originating site was their home. So we're like looking up the patient's address, which we never really experienced that until COVID, where the originating site was the patient's home, or maybe they were in a car. So I mean, we were like, patient's car. That was the interesting kind of dynamic there. But yeah, the originating site it's wherever the patient's located, and for legal terms, it's definitely important that you put that's exactly where the patient was when they exchange that clinical information with you. And distant site. Our distant sites have been interesting as well with Dr. Suter. There was one time where I was in his office in House Springs, and he was visiting his brother in Seattle. And we had a patient with the implant that came in with some pain, and he happened to be in an Uber, and I needed some help. So the distant site was in the Uber in Seattle. So, that was the location of the dentist at the time, but that's really some access right there, right? I mean, but that's teledentistry. So there's two forms of teledentistry. There's the synchronous and the asynchronous. In telehealth, you see there's typically synchronous or asynchronous visits, depending on what type of telehealth application you're looking at. That's like when you think of telemental health, most time it's telemental services. You think of synchronous as something that's happening right live, simultaneously. People are talking back and forth. But asynchronous, you think of the word store and forward. You gather the information and then you forward it to the provider. You also see that with teledermatology. They often do that where they gather the information and send it to the provider for a look. So these different types are kind of synonymous with different types of telehealth, but in dentistry, we usually use asynchronous versus synchronous. So we have direct to consumer and live patient monitoring. Direct to consumer is kind of like a controversial type of teledentistry throughout nationwide, and why some states are kind of hesitant. When you think of direct to consumer, you might think of, it's on the tip of my tongue, but you know how you can make an impression and send it in the mail for braces. That's considered direct to consumer. Because there's not that middleman kind of facilitating the care. And those have had some adverse cases where, some of those patients, you don't know their health history. You might be shifting teeth and they have periodontal disease, or, you don't have that middle provider. So it's a little bit more controversial. And so you see a lot of those clear aligner groups actually advocating for teledentistry for that reason, and states are very hesitant to pass because of that. We use it in a more traditional sense. Live patient monitoring, when you think about smart brushes or toothbrush apps, management of chronic disease, your Apple Watch might be a live patient monitoring type of telehealth apparatus. So it doesn't tell you when to brush your teeth or if you have, but I think that would be cool if it did. So some people could use that reminder.
I was going to say, what does this smart toothbrush do? I mean, does it
It tells you if you brush for 2 minutes. It also lets you know the amount of pressure that you apply on your teeth, and it also lets you know what areas you missed. So yeah, it gets it's pretty thorough. But we consider that.
I think my kids might need one of those. That'd
yeah, absolutely.
Yep.
Yes. Yep. So direct to consumer, we kind of talked about that, like kiosk in the middle of the mall for teeth whitening or something like that. That would be considered like a storefront dentistry where you're not really sure who's the person that's collecting that information and making that determination or diagnosis. I mean, you have diagnostic data taken, but you don't know if there's a licensed health provider determining if whitening is appropriate or if a clear aligner is appropriate for you. So Missouri Medicaid coverage for teledentistry. And this is what we find out. This is what we know about Missouri Medicaid coverage is that it reimburses for the code, the asynchronous codes and the synchronous code with the D995 and D996. It's not really covered in most private insurance cases, which like worries a lot of people when they think about it. But I'll tell you how you kind of get around that and how teledentistry is really still profitable, even if private insurance that don't take those two codes. As you can see, the reimbursement code is 1416. So I don't think it's something that will really deter anyone from doing it whatsoever. So telehealth parity. States have different parity laws for private insurance coverage of telemedicine, and payers are required to cover any services that can be done virtually as if it was done face to face. All those things kind of just depend on the state. So, and we have a parity clause in Missouri saying it's the same whether in person or virtual. Informed consent is super, super important. And like how I make sure that people have informed consent that we're doing teledentistry, and it's actually required in Missouri, but I say, this is a teledentistry assessment. The dentist is not here. I'm just gathering information in order for the dentist to do exams. So they know exactly, they're not going to expect a diagnosis that day when they come and see me. They know that I'm not a dentist. They know that I'm not doing an examination. And also, we also make sure that the patient signs that. You have to make sure when you're collecting the information and you're moving it over to the dentist, whether it's cloud-based or it's some kind of encrypted mail, instant messaging, you want to make sure that you have HIPAA compliance. And that's another thing we do with consulting. We test systems to see how well they work in our workflow and if they have good compliance, if they work well. And so you have to just see what works for your group. Teledentistry journey. My counterpart, Nathan Suter, he's a really big Lord of the Ring fan. So if you see random rings and Tolkien stuff, that's why. One time he took The Office to see the Tolkien movie, like half of us were like asleep in the movie theater, but so you'll see those little reminders of that, of how much he likes Lord of the Rings. But it's always something. We're always trying new things in our office. I mean, we've been doing it for a long time, and a lot of people come to us to learn how to do it, but we're always trying something. Matter when he comes in the office, sometimes I can see the look in his eye that he wants to try something new, and I'm like, oh my gosh, what do you have for me today? But it's always important to always find ways to document new things, new type of imaging, new types of form, ways to better communicate, new policies and procedures. We try to stay on top of that, and that's what kind of makes my job super, super interesting. And we love it because we're not just doing it for ourselves. We're doing it for a lot of people to bring access. And so their programs can run better. Their oral health programs can run better. Their outreach programs can run better. People have better access to dental treatment. So these are some different types of teledentistry visits that you can do. Patient to dentist, hygienist to dentist, medical provider to dentist, allied health provider to dentist, and dentist to specialist. Some of the applications that we talked about before. And here's some different scenarios. And these are the ones that I told you, it's going to kind of make you think. we have, and I'm just going to go over a few, the ones that I think are maybe applicable to a rural health setting, but here's a satellite office coverage. An 11-year-old patient of record with low cavity risk presents for a regular recall and preventive care. The dentist is at the main location providing general supervision of hygienists at the satellite location. The patient is having no pain, and the parent's glad that her child can receive care in an office near the middle school instead of traveling across town to the office where the dentist is today. However, the patient's mother asks you if now is a good time to consult an orthodontist. The patient was scheduled 6 months ago. A digital form was sent with an updated health history to obtain consents. The patient has some crowding on the lower, and K and T are still present, which are teeth numbers. The patient sees the hygienist for updated bite wings as well as a full set of extraoral photographs. The hygienist provides a cleaning, a fluoride, sealants on 2 newly erupted second molars, and you at the main location, a message is sent for you to jump on a webcam discussion with the patient and the parent about the ortho. You review the new and existing radiographs as well as a series of photographs. Once you finish up on a restorative patient, you log into the computer and discuss the findings with the mother. You recommend that between now and the next 6 months recall, the patient has an evaluation with the orthodontist. The referral is given to the parent, and the 6-month recall appointment is scheduled. So that's one application, satellite application of teledentistry. And, necessarily, if the patient didn't have the question about the ortho, then that synchronous probably would not have happened. It would have just been a regular asynchronous appointment, and the doctor would have just did probably call the patient within 72 hours if there was anything wrong with that patient.
Is there a billing difference between asynchronous and synchronous, Tiffany? None. Okay.
No, it's like for Medicaid, it would still be roughly around $15 for that visit. And just think, because a lot of people say, well, the private insurance doesn't cover that, so, teledentistry just doesn't pay. But if you had that satellite location and you were still able to take all these originating site codes, except for that one $15 code, then you made money for sure for that visit, Yeah. Limited evaluation triage. This is something too, I think might be applicable. What we saw in COVID a lot, a 35-year-old female patient is eating and noticed a piece of filling had to come out 2 days prior. The patient is experiencing lingering pain when drinking cold liquids, and it's been keeping her up at night. You are in the office, but you do not have availability. She goes to your website, fills out a teledentistry consent and questionnaire. Your staff reviews the digital form and asks the patient to send a photo of the problem area via secure message platform. One thing about a teledentistry visit is that there has to be an image exchanged in order for some insurance to pay out, especially for the limited evaluation code in dentistry. So you review the digital form and image. Additionally, there's existing radiographs on file. The tooth in question is a maxillary molar between the patients. You create a referral and give it to your treatment coordinator. You recommend that the patient go to the endodontist for root canal therapy. Ask your staff to schedule a follow-up for a crown following the root canal. So that's a form of asynchronous. Let's see. Yeah, this is a good one. You get a phone call from the local nursing home. The nursing home states that a resident and former patient of yours is having pain, has not eaten for a couple of days, and is having trouble sleeping. The nursing home and the family is concerned because the resident is starting to lose weight and believes that the dental pain is affecting his overall well-being. For the most part, the resident is bedbound. It's difficult to transport him outside of the facility. The hygienist goes to the nursing home. The hygienist completes dental hygiene assessments, radiographs, photographs, and takes impressions if needed. The hygienist uses a limited evaluation survey to gather necessary information for the examination. You complete the examination and the treatment plan via teledentistry and determine the correct setting for treatment and the most effective treatment modality based on the patient's health history and ability to tolerate treatment. You decide to place a patient on antibiotics and schedules to go to the nursing home to do an extraction on 30 and 31. So that's a really good example how you can use teledentistry and those scenarios in that scenario. Here's a school-based one. Your office is invited to do a back-to-school outreach event at a local high school. The schedule at the practice is booked for the next 2 months. The office decides to do a teledentistry outreach for the school. The nurse presents a 10th grader who says it's a high priority. She says it's a high priority. And the student frequents her office due for Tylenol because she has a hole in her tooth. The student currently has the fistula, which is an abscess, so number 19. The student's parents are sent digital dental health and consent forms. The hygienist goes to a school, gathers the students who gave consent for treatment. The hygienist completes the dental assessment, radiographs, photographs, prophies, fluoride, sealants if needed on each student that signed up. Your dental office blocks off in the schedule at your office for you to complete the exams on the students. You review the dental hygiene assessment and you determine through examination that that patient needs a root canal number 19, and you coordinate that for that patient. So those are different ways that teledentistry can be used and applied in different types of applications. So I'm going to skip. And then I'm just going to go really quickly over how we do teledentistry. We have like a kind of 4-phase teledentistry model, and then I'll open it up for questions. So our approach includes care coordination at every part of our teledentistry model, where we're looking at social determinants. We're looking at patient needs and expectations, navigation, referral. But the first thing we do is the facilitator, whether it's a hygienist or whoever it is, they do data collection. They gather radiographs, they gather photos, they chart what they see, they do documentation. Then that information is gathered and is sent for examination, or the provider reviews, they diagnose, they treatment plan, and they communicate with the care coordinator what needs to be done. The care coordinator helps with follow-up, where they determine urgency, how quick does that patient needs to be seen. They put them in some type of recall. They schedule the treatment, and they determine what care setting that patient needs to be seen in. So that's how our approach kind of goes when we go into any type of teledentistry appointment. And this is how we teach people to do teledentistry as well. So we kind of talked about the care coordination, what we're kind of looking at. Knowing patient needs and expectations are super important in teledentistry, because a doctor might see a tooth and say, that tooth needs a root canal and crown. But if you ask the patient wants it out. That's what they want, So when the doctor's trying to treatment plan, it's important that the doctor knows that patient does not want a root canal and crown. They rather have that tooth out, and I think that helps for better outcomes in health, when you understand the patient needs and expectations. Can it be done? Because a patient might be like wiggling, and the patient wants to save that tooth. I mean, it can't always be done, but it's definitely important to know and understand what they want. So these are kind of the things that we're looking at throughout the care coordination. Also, the social determinants, because I'm looking, how did that patient come? Do they have insurance? Those are all things important for the doctor to know, because they can't physically see the patient themselves. So we know, like, when you're treatment planning, well, I'm not going to put an implant there. Maybe that patient needs an extraction and a denture versus an implant. So identifying those social determinants are super important. So we talked about data collection. Examination is what happens after that. And this is basically what the doctor does. They review that information, they treatment plan, they diagnose, and they communicate what they found during all that, what I gave them during data collection, they interpret that and they communicate it back. And this usually happens within 72 hours from the data collection to the examination. The patient is contacted by someone and they're let know, they're explaining the treatment plan and what they want to do in their schedule for treatment. And then follow up, the most important, the last steps, but most important, because it really ensures that long lasting relationship. Definitely because this is the virtual nature of the visit. It's really important that the follow up is really fluid and it works really well. Where you establish them in a recall, you make sure you prioritize them by urgency. You look at you always offer different various ways of treatment. These are things that we kind of look at when we do follow up. And I'm gonna end with that. That's pretty much.